Hey, so I want to talk about five or maybe even seven reasons why we need to focus on women in this whole topic of dementia. And well, let me go ahead. Number one is that women are twice as likely to have dementia. There are two times more women with dementia as men than men are. Number two, most caregivers, two-thirds of all caregivers are women. So combining one and two, women are by far carry the burden of dementia, whether they have the condition itself or whether they're taking care of someone with the condition. That's a huge drain on our nation, wherever that nation may be. All right, number three, and this may be controversial, but there have been studies about this, that the drugs that have been used or that are coming out now, especially the anti-amyloid, or lack of a better word, anti-amyloid plaque drugs, are those they have been shown to be not as effective in women as they are in men. Number four, and yes, we can debate about this. Number four is that the vast majority of people who go on to webinars talking about healthcare and health and brain health or body health, whatever, the vast majority are women. In my experience, when we started doing webinars way back in 2008, 2009, then it was GoToMeeting. There was no such thing as Zoom. And yeah, in my meetings, my seminars, it was at least 80% were women. Number five, women tend to take their health more seriously, as evidenced by number four. But also they tend to follow through with these suggestions and the tips and the advice that has been given on these webinars and these seminars, and they tend to apply them to themselves, to their children, to their spouses, so that the whole family is better taken care of. Okay, so these are reasons, or these are five reasons. I'm sure there are other reasons as well. Yeah, so number six would be that uh, there are. It seems to me that there are more um, risk factors that women are faced with that they may not readily see that affect them or affect their brains and can lead them on the path to dementia. Yes, we're all surrounded by toxins and environmental threats and so on and so forth. But where women are concerned, they seem to be more, these threats to their brains seem to be more. By the way, I've come out with 12 reasons why women have higher rates of dementia than men. And it'd be great to check it out. It's on our website, drdavidajibade.com. And I go through these 12 reasons. And again, we can debate that, we can discuss it further. But I really think that we should focus and not just um, casually dismiss the topic as something where everybody's still researching on. I mean, when are we going to get answers? We can't wait to be 100% sure. That's my opinion. We cannot wait to be 100% sure before providing women with the tools that they need, that you all need to protect your brains and therefore reduce this burden, this growing burden of dementia on our communities and our nations. We need to help people have healthy brains starting right now. So take care. You want to check us out, or you want to book an appointment with me, the information is somewhere around this video. So I think we're given about 15 minutes free consultation, aren't we? I don't know. Maybe we are. Let us reach out to us and we can help point you in the right direction. God bless. Take care. Bye. Okay, so I want to talk about the importance of having a framework to think about things like brain health, memory loss, dementia, and so on, brain disorders. I think it's very important because it helps us to better understand how to address other circumstances and other situations. For instance, how I came across, uh, sorry about that. So, for instance, how I came across the whole idea of why blacks have it worse is after I'd created the whole 12, 12 reasons, the Dementia's Dirty Dozen, it gave me a framework or like a checklist to look at each item and say, okay, where are blacks falling short? Uh, I got to do this again, guys. Okay. All right, we're going to start again. I just hope this person doesn't buzz me again. Okay. All right. So let's start again. Hi. So the whole idea behind the Dementia's Dirty Dozen is to create a framework to work from, so like a checklist for you to look at other conditions, not other conditions, but specific factors or specific demographics, and say, why do these people have higher risks of dementia than the rest of the population? For instance, Black people have twice the rate of dementia as white people. The way I came across, or the way I tried to figure it out, was by going through each item in the Dementia's Dirty Dozen and seeing which ones stand out, or which ones, or in which areas Blacks are falling short. For instance, with illnesses, which is number one, illnesses. So that would include cardiovascular illnesses, neurological illnesses, mental health illnesses, and metabolic illnesses. The things that stand out the most are diabetes, hypertension, cardiovascular disease. Blacks by far have much higher rates of these conditions. And so we were able to like say, okay, yeah, this would be one factor in the whole reasons why Blacks have higher rates of dementia. Also, when it comes to women, women have twice the rate of dementia as men do. So again, I look at the list of Dementia's Dirty Dozen, and a couple of things that stand out are mental health challenges. Women have serious mental health challenges. Now, I gotta be careful. Women tend to have higher rates of mental health challenges, anxiety, depression, than men do. Same thing with immune dysfunction. Another of the factors in Dementia's Dirty Dozen. Immune dysfunction, women tend to have 4 times the incidence of autoimmune conditions than men do. So that's another factor right there. Sleep disturbances, another factor. So we look at these things and we say, okay, this is another one we can use are the military. In the military, especially those who have worked in active duty combat zones, they're exposed to a lot more mental stress, especially those who have actually killed or seen dead bodies or seen people killed. They will have certain issues that will affect them and can continue to affect them throughout their lives. Also, those who, again, with military active duty servicemen, they're exposed to toxins. Agent Orange, obviously, is a good example from the Vietnam War. But day to day, even in the fields, they tend to be more exposed to certain toxins than the average person. Whether it's cleaning agents or whether it's the smell of gunpowder and so on. So and then their food. Here's another thing: their food is let's just call it what it is. The food that they are fed in the fields are not what you would call gourmet. I mean, they're pretty bad when it comes to nutrition and nutrient density. So I mean, they just feed them really just to keep them alive and keep them going. But in terms of real healthy food for the brain and body, they're falling short there. So again, you can see the whole idea is to create this framework that people can use as a checklist or use as what you call it, an Excel spreadsheet, and just punch in the numbers, so to speak, and then see where certain things add up. I also use it to create my Keeping Your Marbles course, and there's information you can check the link for that. We sell that course, or we make it available to different organizations as a complete, so to speak, workshop. So it basically tells you what to avoid, what to do specifically, and then to take control of your health, and then how to interact with the healthcare system by way of tests, treatments, consultations with the different healthcare professionals. So it gives you like a full package deal on really what to do to take control of your health. So I hope you will take advantage of this. There's a free ebook for Dementia's Dirty Dozen. So I hope you will take advantage of it and you will use it. Till then, we will see you in the next video. Take care. Bye. All right. So let's talk about. Oops. So this is the next video. All right, so let's talk about drugs and dementia. Now, I know it's not one of the dirty dozen because it applies to many aspects of the dirty dozen. So we talk about illnesses as one factor in the dirty dozen: infections, immune dysfunction, insomnia. Drugs play a role in pretty much most of these things. Maybe not when it comes to inactivity or when it comes to uh, isolation, but in most of these factors, drugs play a role. So that's why it's not a separate factor. It's an all-pervasive factor, so to speak. And so let's talk about some of the most common, everyday, over-the-counter drugs that people use that tend to. Now, I'm not saying this is a direct causative factor, but it can, shall we say, compromise brain function. And if used chronically over time, it can certainly put you on the path to dementia, especially if you're an older person in your 60s and above. So let's talk about some of them. On the first on the list are the anticholinergics. Perfect example is Benadryl, which is used for all kinds of things, including cold decongestion, medications. Almost everybody knows what Benadryl is. It is not necessarily a bad drug. It is when it's used consistently. And one of the problems with it is that it blocks or it antagonizes the effects of acetylcholine, which is the primary memory neurotransmitter. And it does other things, but specifically it blocks and adversely affects acetylcholine. Over a period of time, if acetylcholine is blocked or not working like it should, you will have problems. So it's very important, and this goes for all the other drugs we're going to be discussing. This goes for all the other drugs that you do not want to be using these on a prolonged basis. I would advise that you get a nutritional alternative that you can use. All right, number two are the benzodiazepines. The obvious example is diazepam. Great for anxiety, great for calming you down, great for sleep. But this also can affect your brain function, especially neurotransmitter function. Not as badly as like the anticholinergics, which specifically target choline, acetylcholine, but nevertheless, they're important. Another one that's this is this drives home the point for me are the PPIs, the proton pump inhibitors, and these basically try to block acid, try to reduce the acid in your stomach to provide relief. And yes, they have been effective when it comes to that, but at the same time, they result in the diminished absorption of vitamin B12, which, as you may know, is vital for brain function. As a matter of fact, if you're deficient in vitamin B12, your brain cells are automatically prone to them. In fact, they're just, I'm just going to tell you straight. Lack of vitamin B12 results in damaged brain cells straight off. All right. So you do not want to be using protein pump inhibitors or H2 blockers, which is also another form of acid blocker, over a long period of time, because it can cause, you can pay for it in the long run. Another one are the opioids. We've heard about the opioid epidemic, pain relief, very helpful for those who are dealing with chronic pain, but it can cause addictions and directly affects brain function. So you want to look out for that. Another one are the antidepressants. I'm going to run through the rest. Antidepressants, antipsychotics, steroids, which are used for pain, and sleep aids. Now, I'm a big proponent, a very big proponent of sleep as a way to improve brain health. Three things that really stand out as to the importance of good quantity sleep. By quantity, I mean 7 hours of sleep. Some people laugh at me when I say that. 6 hours, they've shown that 6 hours, even 6 hours is bad. So, but there's a lot you can do to ensure that whether you're having 4 hours sleep, 5 hours sleep, or 6 hours sleep, you can make the most of it I have a video to that effect. You can please check it out. But back to sleep now. The three things that sleep is most important for: memory formation and consolidation. Number two, detoxification is during sleep that your brain flushes out the toxins and cleans itself up. And number three is repair and regeneration. That is when brain cells are repaired, the tracts, the channels, the connections between brain cells are pruned and optimized, and so on and so forth. That's during that sleep time that these things happen. So if your sleep is interrupted, or your sleep is not as long as it should be, or your sleep is too shallow or too light over a period of time, you're not going to get the best out of it. So it is absolutely important that you optimize your sleep. One of the ways you do that is by making sure you sleep in a very dark environment, or use a sleep mask to block out the light. So you've got to do everything. I always say you got to do everything to make sure you sleep well. Now, when drugs are concerned, you're probably going to need to be careful, because some of these sleep medications, some of these sedative drugs can cause brain impairment. So I would really opt more for the natural or the nutritional or nutraceutical route, as opposed to the hardcore medication route. Whatever you do, you need to make sure they are sleeping well every night. Okay, so that rounds it up for me. These are about 7 or 8, close to 10 medications or groups of medications that you want to be aware of, especially if you're over the age of 60. You want to not use these on a chronic basis, because they can and will affect your brain adversely. So check them out, speak with your doctor, look for alternatives. If you need any help, reach out to us. We sometimes offer free 15-minute consultations, and they could be very valuable because we can point you in the right direction. Till then, we will see you in the next video. Stay strong. Bye. Hi, so you probably heard the term dementia is Alzheimer's type. Oh, I'm sorry. All right, let's just start again. Hello, so you probably heard the term diabetes type 3 before, speaking about Alzheimer's disease or dementia, saying that, obviously saying that because, okay, I'm going to start again. So you probably heard the term Alzheimer's dementia is diabetes type 3 before, and that has caught on a lot, and it does have its merits, because a lot of the time, sugar, or the ability to metabolize sugar in the brain is affected, and so with that, there's high levels of insulin, and there are a lot of similarities with diabetes, and that, again, that's why it's called diabetes type 3. But I have a problem with that term, because it's not all income. It's not all dementia that is related to just blood sugar levels or insulin levels. And yes, insulin plays a very important part in brain function. However, there are things like toxins, there are things like trauma, there are things like energy balances that have nothing to do, at least at first, with sugar. And I think we narrow or we pigeonhole ourselves too much when we just attribute it to just sugar and the brain. Again, don't get me wrong, it's very, very important. And in fact, they're actually using, in some quarters, they're using insulin, intranasal insulin, spraying insulin into the nose to get to the brain. And they're showing that it does show improvement in the subjects or the patients that are trying this out. So don't get me wrong. All I'm saying is that there's a lot more to dementia than just diabetes or high sugar levels. It's a lot more nuanced than that. And every time we try to think of one thing, and every time we try, I think we get in trouble. Or we're getting in trouble over and over again when we just try to look for that one magic pill, that one magic bullet that's gonna do everything, is gonna sort out all our problems and save the world. It's so far that hasn't happened. I really don't see it happening. And in my opinion, to a very large extent, the onus or the responsibility or the burden lies on the individual and his or her family to save their own brains, so to speak. So it's never just one drug, and it's certainly not just about sugar. Sugar does play a role, energy plays a role, but there's a lot more to it than that. And if you want to see more about about the different causes and how the brain reacts, please check out our videos in our playlist, or you can reach out to us and we can have a consultation. Till then, God bless, take care, bye. All right. Okay, so the title of this video is "The More You Live." No, I'm sorry. I guess that again. Hi. So the title of this video is "Move You Live, Stay Put, You Die," so to speak. I know that's kind of like over the top, melodramatic, but it does have some merit to it because movement, more and more, we're seeing the importance of physical movement to healthy brain structure and function. You stay put, you're not getting as good enough results for your brain. Now, obviously, there are people who are paralyzed and people who deal with other issues. The brain tends to compensate. But if you're just being lazy, you're not moving around, you're not exercising, it is going to affect your brain adversely. And now we're finding out that it's not just movement or walking or even running or any kind of aerobic exercise. Especially if you're over the age of 50, you need more than just that. You need to stress your muscles. You need to build muscles, build strength. And I'm not talking about the whole Arnold Schwarzenegger thing where you're pumping iron. If you can pump iron, that's a good thing. But the more important thing is stressing your muscles on a daily, regular basis. And from what the research says is that when you do these things, this stressing of your muscles stimulates the production of chemicals like called myo or muscle chemicals, which act as anti-inflammatory for the brain, anti-inflammatories for the brain, and also growth factors for the brain. So it's really important that even though it's harder as you grow older to build muscle and to train, it is probably one of the best things you can do for your brain health. So I really encourage you to look into that. There's this really good book called Strong Forever. I believe I have that here by Dr. Gabrielle Lyon. An S, yeah, Lyon, Gabrielle Lyon. Oh yeah, so they just Forever Strong. I really would encourage you to take a look at that and see that and try to use that as in one of your daily practices. Strengthen. I have like this little, I don't know what you can call them, this I don't know what do you call them, this rubber band. It's not a band, but it's like a rubber tube that has some resistance on it, and I try to use that every time before I go into the bathroom. I really do that to take a shower. And I do that, and I do feel some strength. I do feel some pain, and that's always a good thing if it's done in the right way. So I want to encourage you to do that. God bless. See you soon. Bye.